The medical process of surrogacy obviously involves several carefully coordinated steps, including the in vitro fertilization, which we call IVF, the patient or surrogate preparations, and obviously the embryo transfer. I will do my best to go over the different steps to help the intended parents and surrogates understand what to expect. So one of the first things, obviously, will be deciding when it is time to visit maybe a fertility clinic. But usually when you start and you have determined, usually it will be the initial consultation once you have selected an IVF clinic. That is basically where the intended parents meet with the fertility clinic team or the doctor. And during that very visit, things that they discuss will be about their medical history, obviously, the family building goals, and potential use, if needed, obviously egg or sperm donors. And it's during those consultations that they can ask the clinic and the doctor a whole lot about the IVF process, the courses that it's going to cost, and obviously the timelines, what they can expect. So once I think they have the consultation and they agree to proceed, for the intended parents comes these so-called medical tests and screenings. Usually the intended parents will undergo some labs, blood works, and then usually for the males, they will do the sperm analysis if they are doing their own sperm. So usually after reviewing these results, the IVF clinic will schedule another consultation to create a so-called embryo transfer or egg retrieval, usually egg retrieval first, if they're doing their own eggs, a so-called cycle calendar. And then sometimes during this consultation, they will also, based on obviously the results, the labs, they might determine, hey, if a surrogate will be required down the line when it comes to embryo transfers. Sometimes it will be a little bit later, but usually during this time, the doctors will be able to get an just idea, sort of like if a surrogate might be needed or required. That could be based on the age or based on the medical conditions, or different numbers based on the blood work. And the initial consultation and screenings, this things that we talk about, usually will take about 2 to 4 weeks in terms of timeline. Now, once this is done, usually they will go to the so-called IVF process, and that will usually start with the egg retrieval, obviously, and then you'll be looking about once you have the so-called calendar down, egg retrieval calendar, they will follow the calendar and start what we call ovarian stimulation, and that's when the intended mother or egg donor, if they're using egg donors, they will begin daily hormone injections. Now, these injections and medications usually will last 10 to 14 days. This medications usually help stimulate the ovaries to produce multiple eggs instead of just one during a natural cycle. With this comes regular monitoring appointments, which happens every 2 to 3 days, with ultrasounds and blood works to ensure the safe and effectiveness of the cycle of the stimulation. Once that is done, usually it comes obviously with the egg retrieval. During that is basically once the follicles reach maturity, I should say. The trigger shot is usually given and administered to prepare for the egg retrieval. The eggs are usually collected through an invasive procedure using a needle guided by ultrasound, performed under sedation, obviously by the IVF doctor. Now, this procedure usually is pretty quick. It takes about 20 to 30 minutes. So once that is collected, obviously, usually on the day of the egg retrieval or sometimes a little bit before, if, let's say, the male partner has sperms, usually that sperm is collected as well from the intended father or the donor at that time, and then it's obviously the fertilization of the embryo, right? Eggs usually are fertilized with IVF. Basically, that's usually not going into specific details, but usually that's sperm and egg combined to a lab dish. Or another thing that they do is called ICSI. That's a form of sperm injection where a single sperm is injected into each egg to provide a higher chance of success. So once that is done, then usually that is for the embryo to grow. They call it embryo culture and testing usually. Now, embryos are usually monitored around 3 to 7 days. A lot of the standard in the industry is about 5 days for it to grow. Also, once that is done, they might do genetic testings Now, genetic testings are done to really screen for any genetic issues, problems, or inherited conditions, if there's any, to make sure those embryos are of top-notch quality and which ones might not be the ideal ones to use. The timeline for the whole cycle, I will say from the start of the stimulation to the so-called embryo freezing, usually takes about 4 to 6 weeks. Now, after you have the embryos, obviously that's when they will determine or know beforehand that if they're going to transfer the embryo directly to the intended parent, the clientele, or if a surrogate is needed. But the steps are similar for both. It's usually they'll have to go through, I think if there's a surrogate involved, when the clinic determines a surrogate is needed, obviously there's going to be medical tests and screening for the surrogate. So what does the clinic look for in terms of when they are doing screening for the surrogate? So the clinics will usually complete a detailed health and reproductive history review based on medical reports from the surrogate's past OBs or delivery hospitals. She will undergo physical exams, also evaluations of the uterine to make sure it's okay. They will usually use a saline sonogram, and obviously there's going to be blood tests to be run to make sure she's clean and free of drug and other stuff related. So once that's done, obviously sometimes the clinic will set time to have consultation with the surrogate. They will discuss the legal and emotional implications of a pregnancy, right? Talking about mental, they will also have a psych screening evaluation for the surrogate to assess emotional preparedness and the ability to handle the surrogate journey. Now, sometimes a clinic will also run psych screenings for the intended parents as well. Sometimes they even have joint evaluations in the end where both the intended parents and the surrogates join one session and do one psych session together. So once everything's clear, it's good. Usually what the clinic do is they will provide a medical clearance. Now, to get the so-called medical, usually the medical and psych screenings for surrogate usually takes anywhere from 3 to 6 weeks. That's about the average range of time. Now, once that is done, regardless if they are using the clientele, the parents are using surrogates or they're transferring themselves, then it is obviously so-called time to do the embryo transfer. Now, for the medical embryo transfer stage, in general, they will have to prepare the patient or the surrogate. So what usually happens is same thing. They will have a calendar, the embryo transfer calendar this time, and they will have to follow through the calendar that is issued and prepared by the clinic. Now, once the so-called calendar started, obviously they will have to do, doesn't matter if it's the patient or if the surrogate, they will do the same thing. They will do hormone injections, usually estrogen, usually to begin 2 to 4 weeks before the embryo transfer. That is helped to build the uterine lining to make sure it's good and ideal for transfer. And then comes usually progestin injections. That usually is a few days before the transfer. That is to support the implantation of the embryo, right? And during this time, regular monitoring appointments with blood works, with ultrasounds will be ensured. Basically what happened to ensure that the parents or surrogate's body is ready and the cycle and the journey is going well. Once they reach a state where everything's good, they go to the embryo transfer stage. And that is basically the intended parents will select a high quality embryo, hopefully. They'll make sure that the embryo quality, the embryo at the time is defrosted if it's frozen, and then it's placed into the surrogate's uterus or their own uterus if they're doing it themselves. Obviously, that will be under professional guidance of the IVF doctor. The procedure is really quick. It's usually about 10 to 20 minutes. Typically does not require any sedation. So it's even easier than an egg retrieval. After that, usually it's called post-transfer process. And usually with that, the patients or the surrogate will continue using hormone injections, estrogen and progestin, for about 10 to 12 weeks to maintain the pregnancy until the body's placenta can take over and start doing hormone productions. Before then, they will have to continue using this medication. So after the embryo transfer, I'll have to say about around 10 to 14 days, usually when they will have to do a blood test, a beta HCG, to make sure that determine if it's successful, right? And then they might do second blood works if needed. And then if HCG is positive, usually around 6 to 7 weeks after the embryo transfer, they will do an ultrasound to make sure and confirm the presence of a heartbeat. That's a little bit, probably 2 to 3 weeks after down the line, sometimes longer after the HCG test. That's when they'll do the ultrasound for the heartbeat confirmation. Usually once after heartbeat confirmation, it will be IVF graduation to the OB. So usually what happens is once a strong heartbeat is confirmed, pregnancy continues and progresses. The surrogate of all the patient or the parents, they graduate from the fertility clinic to go to their own OB or continue prenatal care monitoring. Now this usually happens around 7 to 10 weeks after the embryo transfer. So that's usually the medical process of the IVF clinic. Now preparing the patient or surrogate for embryo transfer from the very beginning to successful HCG tests. Start the cycle with injections to successful HCG tests in a successful cycle usually takes about 4 to 6 weeks. If you talk about waiting for heartbeat confirmation, then it could be all the way to last to 7 to 8 weeks. And then the graduation is usually 8 to 10 weeks from when the cycle started. I went through a lot, so I think I can do a key timeline so people can get a better understanding of the importance timeline that I just went over. So usually if it's pre-IVF prep, usually it's 2 to 4 weeks for medical consultations and the screening results. And then when you talk about the ovarian stimulation and the egg retrieval, it usually takes about 2 to 3 weeks. Once you have the eggs and the sperm, and then you do the so-called embryo growing, culture, and selection, usually that takes 3 to 7 days. But sometimes they do genetic testing on those embryos, and that could take anywhere for another week or 2 to get the results out. Now, in regards to preparation for the embryo transfer and the cycle process, that's usually 2 to 4 weeks of hormone injections and then the actual transfer. And then for the embryo transfer all the way to pregnancy confirmation with HCG testing, usually it's about 2 weeks of time. To heartbeat confirmation, it's usually about 4 to 5 weeks. So I think in general, in one successful cycle, meaning you do one transfer and then you are HCG positive and then you have heartbeat, we call that a one successful cycle. I think you can expect 2.5 months to 4 months from the initial consultation to a successful pregnancy confirmation. Now, if transferring embryo to a surrogate, then obviously one can expect to add an extra 2 to 3 months time. Now, the extra time is really due to the medical screening for the surrogates and also the legal proceedings, because before you can have a surrogate do a transfer for your embryos, there's got to be legal clearance, paperwork, documentations in order first, right? So after the medical clearance for the surrogate, that's when both parties will enter legal. Now, the clinics will not transfer without the legal paperwork. That's very important, right? So legal usually will take about 1 to 2 months depending, right? So that's why if they're doing a surrogate transfer, they can expect to add an extra 2 to 3 months because she has to do screening and also the legal procedure. When you talk about so-called medical challenges or risk for the IVF journey, obviously not every journey or cycle is going to be successful. That's the way it is. Now, for the surrogates, usually with the medication that they inject, right, they might have side effects from the medication, bloating, mood swings, because you're injecting hormone, right, into the body. But once they are pregnant, usually the usual risk associated with normal pregnancy happens. Sometimes it could be gestational diabetes, it could be pregnancy-related high blood pressure, it could be preterm labor, it could be morning sickness, the usual. But that's almost the same with a normal pregnancy. Now, in terms for the intended parents, as I mentioned before, now unfortunately with the embryo transfer cycle success rate, it's not 100%, right? It's the way it is. Now, different clinics going to report different numbers, but the average embryo transfer success rate in the nation is around 50 to 55%. And this is from other clinics clinics that we have seen, we work with, and we work with many different clinics around the States. Now, obviously, when you talk about 50 to 55% success rate, is a very high, almost half success rate. Unsuccessful rate as well, right? That could lead to multiple IVF attempts. If there are more embryos, obviously that's additional courses, and that takes a stress on the mental health as well, right? So it's more about emotional and mental stress if implantation fails or pregnancy complications arises. Now we talk about the so-called success rate of embryo transfer cycle. It's about 50 to 55%. I think a lot of people might ask, why that is the reason. And without going into medical, details, it's just basically general. It really depends on several factors, including the age of the patient, age of the surrogate, the quality of the embryos, the main cause of infertility, the clinic's doctor's specific techniques that they use for the cycle. When a cycle is not successful, the doctors of the clinic, they will review and determine the reason for the unsuccessful, and then if they'll continue with the same surrogate, the doctors of the clinics will adjust the calendar or adjust some of the so-called flow or sequence or so-called volume amount of the medication. They will twist it a little bit to provide a better success rate. And usually the second time transfer, success rate jumps all the way from 50 to 55 to 60 to 65%. That's really because of the reasons I talk about, right? Clinic and the doctors adjusting some of the methods used based on the cycle's results. These figures obviously can vary from clinic to clinic, and the use of also genetic screening, PGS testings of those embryos, fresh versus frozen embryos can also highly influence the outcome of the success rate. So I think it is really important to consult with the fertility specialist, the doctor at the IVF clinic, to come up with a more personalized data based on individual circumstances. So that's the overview of why the success rate is around 55%. I did the whole process of doing the medications and injections for the egg retrievals really is to try to create as many eggs as possible. And also with the sperm, obviously a healthy sperm and stuff, and to create a higher success rate when making the embryo. But obviously, even in real life, sometimes, the success rate of getting pregnant, unfortunately, is very, very low. So you can understand, even with that, it's not always, a lot of these so-called created embryos, sometimes they don't survive to the 3 or the 5 days. There's ones that survive at least 3 or 5 days that really got to continue. They will have to keep track of the growth. And not only that, a lot of the clients and the intended parents, they want to do genetic testing to the embryos as well. And so with the genetic testing, sometimes even if you have a lot of embryos made, the genetic testing might cut down, believe it or not, around half of the embryos that you have. In half of them, you might have genetic issues or imperfections, right? So that leaves you only half of the embryos that you made that could be used, and none of them is of the highest qualities. That's why sometimes a lot of the clientels or intended parents, they will have to do 2 or 3 egg retrievals just to get enough eggs or so-called embryos down the line. Yep, that's why selecting a good clinic, good doctor, obviously that's very important. And then if it comes down to the clientele, the parents have to use surrogates. Selecting the correct agency is very, very important as well, right? Because not everything's going to be smooth. There will be complications and issues along the line, but it's how these third parties, how these agencies or clinics or doctors are able to adjust, implement, and to be able to help to move or overcome the complications. So that's why it is of the utmost important, selecting the correct doctors, and the right agency. So, in majority of the cases, it will be obviously finding the doctors, knowing that we might, the so-called clientele, the parents saying we might really need fertility guidance, right, in terms of going to see a doctor. Sometimes it doesn't work, then obviously they will have to do the retrievals, making the embryos with the IVF clinics help. So a lot of them, as long as the body is okay, the age is okay, sometimes they will be able to carry their own embryos, right, to carry the child. It's when they are not able to do so with the recommendation of the so-called IVF clinic or doctors that allow this parent to start looking into surrogacy. So I would have to say a lot of the clientele or intended parents that come to the agency, to us, is already have embryos or are currently going through cycles, and the clinics tell them they have to use surrogate. So now we do have some clienteles that might done journeys before and unsuccessful, and they need to try another clinic. They might come to us and ask to see if we have any IVF clinics or good doctors that we can refer them to. But they're very, very rare, because the majority of our clienteles, they already have embryos ready to go when they start the journey. If you want to understand more about so-called the IVF's medical aspects inside, obviously you have to talk to IVF clinic, you have to talk to a doctor, you have to do consultations, you have to do screening testings, right? But now when it comes to the part when you really have to do agency, then obviously you come to us, agencies, and then you understand the process, to go over more about the courses, the so-called financial timeline, when to make payments, when to deposit the amount, what services are provided, what packages are provided. So it gets really, really detailed. Hopefully I'm able to provide help, that we're able to provide this assistance to new intended parents or new surrogates that are just entering the process. Giving trees, surrogacy.